Have you ever felt that something might be wrong with your health, but you brushed it aside, thinking it was nothing serious? Now imagine this. What if that small symptom you ignored was your body's way of warning you about a life-threatening condition, like clogged arteries? Wouldn't you want to act on it before it's too late? Heart disease is the world's leading cause of death, claiming millions of lives every year. Yet many people don't realize the danger hiding in plain sight: clogged arteries. These blockages can build up silently over time, triggered by factors like poor diet, lack of exercise, smoking, or genetics. By the time symptoms appear, it may already be serious. But here's the good news. Your body often gives subtle signs that something isn't right. The problem is, most people don't recognize these symptoms or don't act quickly enough. That's why this video is here, to help you identify 9 warning signs of clogged arteries that could save your life if caught early. This video is for anyone who cares about their health or the well-being of their loved ones. Whether you're feeling some of these symptoms yourself or want to educate yourself to prevent future problems, we've got you covered. You'll discover not just the warning signs, but also practical examples, actionable steps, and strategies to take control of your health. This isn't just about raising awareness. It's about equipping you with the knowledge you need to act before it's too late. If you find this information helpful, please like this video, share it with friends and family, and subscribe to our channel. By doing so, you're helping to spread life-saving knowledge and encouraging us to create more valuable content for you. Let's get started with the first warning sign you absolutely shouldn't ignore. Shortness of breath, your heart's subtle SOS signal. Breathing is something we often take for granted, until it becomes difficult. Imagine walking up a flight of stairs or carrying a bag of groceries and suddenly, you find yourself gasping for air. At first, you might shrug it off, thinking, maybe I'm just out of shape. But what if this shortness of breath is more than a fitness issue? What if it's your body trying to warn you about a deeper problem? Why does this happen? Shortness of breath, medically known as dyspnea, is often an overlooked symptom, but it can be a critical warning sign of underlying health issues, particularly related to your heart. One of the most common causes of unexplained breathlessness is clogged arteries. When plaque builds up in your coronary arteries, a condition known as coronary artery disease, CAD, it restricts the flow of blood to your heart. This means your heart has to work much harder to pump oxygen-rich blood throughout your body, even during simple activities. When your heart struggles to get enough oxygen, your body starts to feel the effects, and you may notice yourself becoming winded or fatigued from tasks that were once effortless. Over time, if left untreated, this can lead to more severe conditions, including heart attacks or chronic heart failure. What are the warning signs? Shortness of breath may not always seem like an urgent issue, but it's essential to recognize when it becomes persistent or occurs during activities that should not normally cause you to feel breathless. Warning signs to watch for include feeling winded during light physical activities like walking, climbing stairs, or doing household chores. Difficulty catching your breath even while resting or lying down. Experiencing a tight or heavy sensation in your chest alongside breathlessness. Feeling unusually tired or weak, especially during activities you previously managed with ease. What you can do about it. Taking action early is crucial to managing symptoms and preventing serious complications. Here are some steps to address shortness of breath and protect your heart health. Pay attention to patterns. Start by observing when you feel short of breath. Does it happen after climbing stairs? While walking short distances? Or does it occur even when you're at rest? Identifying these patterns can help you and your doctor pinpoint the cause more effectively. Record your symptoms. Keeping a journal of your symptoms can provide valuable insights. Note details such as the time of day you feel breathless, the activity you were doing, how long the breathlessness lasted, and any other sensations you experienced, e.g., chest discomfort, dizziness. This information can be critical during a medical evaluation. Consult a doctor. If you notice persistent or worsening symptoms, don't delay seeking medical advice. A healthcare provider can perform tests to determine the root cause of your breathlessness. Common diagnostic tools include stress tests, echocardiograms, electrocardiograms, EKGs, or chest X-rays. These tests help assess your heart's function and detect potential blockages or other cardiovascular issues. Adopt a heart-healthy lifestyle. Prevention plays a significant role in protecting your heart. Adopting healthier habits can reduce your risk of clogged arteries and improve your overall well-being. Exercise regularly. Engage in moderate physical activity, such as brisk walking, swimming, or cycling, for at least 150 minutes per week. Follow a balanced diet. Focus on a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats while limiting processed foods, salt, and saturated fats. Quit smoking. Smoking damages your blood vessels and significantly increases the risk of coronary artery disease. Seek support to quit if needed. Manage stress. Chronic stress can strain your heart. Practice relaxation techniques like meditation, yoga, or deep breathing exercises. Monitor your health. Keep track of your blood pressure, cholesterol levels, and weight to ensure they remain within healthy ranges. Why it's important not to ignore shortness of breath. Shortness of breath may seem like a minor inconvenience at first, but it's often one of the earliest signs that your heart may be in trouble. Ignoring these symptoms can lead to more severe complications, such as a heart attack or chronic heart failure. Your body has a way of signaling when something isn't right. Listen to it. Key takeaway. Breathing is fundamental to life, and struggling to breathe should never be brushed aside as a normal part of aging or a lack of fitness. Persistent or unexplained breathlessness is your heart's way of asking for help. By recognizing the signs early, taking proactive steps, and consulting your doctor, you can safeguard your heart health and improve your quality of life. Don't wait. Your heart deserves your attention. Chest pain or discomfort, the classic red flag. When people think about heart problems, chest pain is often the first symptom that comes to mind, and for good reason. Medically referred to as angina, chest pain is one of the most recognizable and telling signs that your arteries may be clogged. However, not all chest pain is the same, and it doesn't always come with the dramatic scenarios often depicted in movies. Understanding the nature of this symptom can help you act quickly and appropriately when your body sends warning signals. What does it feel like? Chest pain caused by clogged arteries usually feels like pressure, tightness, or a squeezing sensation in the chest. Many people describe it as a heavy weight pressing down on their chest. Some even compare it to the feeling of an elephant sitting on them. This discomfort typically occurs in the center or left side of the chest and may radiate to other parts of the body, such as the arms, neck, jaw, shoulders, or back. It's important to note that chest pain doesn't always present as severe or sharp. It can be mild or come and go, leading some people to dismiss it as indigestion, muscle strain, or stress. However, recurring or unexplained chest discomfort should never be ignored, as it could indicate that your heart isn't receiving enough blood due to narrowed or blocked arteries. When does it happen? Chest pain related to heart problems often occurs during activities that make your heart work harder, such as physical exertion or emotional stress. This is because your heart demands more oxygen-rich blood during these moments, but if your arteries are partially blocked, the blood flow is insufficient, leading to pain or discomfort. For example, you might notice chest tightness after climbing stairs, walking briskly, or lifting heavy objects. In some cases, the pain might also be triggered by emotional stress or anxiety, as these states cause the heart to beat faster and require more oxygen. The discomfort usually subsides with rest or relaxation, but its recurrence is a sign that your heart needs attention. What you can do about it? Recognizing the signs and taking action can make all the difference when it comes to chest pain. Here's what you should do. Don't self-diagnose. Not all chest pain is related to the heart. It could stem from other conditions like acid reflux, muscle strain, or even anxiety. However, it's better to err on the side of caution. If you experience chest pain that worsens with activity, persists, or doesn't go away, seek medical attention immediately. Watch for other symptoms. Chest pain accompanied by additional symptoms, such as sweating, nausea, dizziness, or shortness of breath, is a medical emergency. These signs may indicate a heart attack or severe coronary artery disease, and immediate care could save your life. Get a proper diagnosis. If you're experiencing recurring or unexplained chest discomfort, consult your doctor. Diagnostic tests like an electrocardiogram, EKG, stress test, or coronary angiogram can help determine if clogged arteries are the underlying cause. Early detection is key to preventing more serious complications. Adopt a heart-healthy lifestyle. Lifestyle changes can significantly reduce your risk of clogged arteries and improve your overall heart health. Eat a heart-friendly diet. Incorporate more leafy greens, whole grains, nuts, fatty fish, and fresh fruits into your meals. Reduce your intake of processed foods, saturated fats, and excess sodium. Exercise regularly. Engage in moderate physical activity for at least 30 minutes a day, 5 days a week, to strengthen your heart and improve circulation. Manage stress. Practice mindfulness, meditation, or engage in relaxing hobbies to reduce stress, which can take a toll on your heart over time. Quit smoking. Smoking damages your arteries and significantly increases your risk of heart disease. Seek support to quit if needed. Monitor your health. Regularly check your blood pressure, cholesterol levels, and weight to keep them within healthy ranges. Why it's important to pay attention. Chest pain is one of the most important warning signals your body can give you. While not every episode of chest discomfort is life-threatening, ignoring it could have serious consequences. It's your body's way of telling you that something might be wrong, and addressing it early can prevent more severe complications like a heart attack or chronic heart disease. Key takeaway. Chest pain or discomfort is a classic red flag for clogged arteries and potential heart problems. While it's easy to dismiss or downplay mild symptoms, doing so could put your health at risk. Recognize the signs, seek medical attention, and make lifestyle adjustments to protect your heart. Your body is giving you a warning. Don't ignore it. Temporary vision loss, a silent warning from your eyes. Imagine experiencing a sudden, painless loss of vision in one eye that resolves just as quickly as it appeared. While it might seem like a harmless, one-time event, temporary vision loss could be a crucial warning sign of a carotid artery blockage, a condition that demands immediate medical attention. What causes this phenomenon? The carotid arteries, located on either side of your neck, are essential for delivering oxygen-rich blood to your brain and eyes. When these arteries become clogged due to plaque buildup, blood flow is restricted. Occasionally, small pieces of plaque or blood clots can break loose and travel to the eye, temporarily blocking blood flow to the retina. This condition, known as amaurosis fugax, is often referred to as a mini-stroke of the eye. What does it feel like? Temporary vision loss typically affects one eye and is often described as a curtain or shade descending over your field of vision. The episode usually lasts a few seconds to a few minutes and resolves on its own. Although it is painless, this symptom should not be ignored, as it signals that something more serious may be happening within your arteries. What should you do if this happens? Seek immediate medical attention. Temporary vision loss is a medical emergency. Visit a doctor or emergency room as soon as possible to evaluate your carotid arteries and overall cardiovascular health. Undergo diagnostic tests. Your doctor may recommend tests like a carotid ultrasound, CT scan, or MRI to assess blood flow and detect any blockages in the arteries. These diagnostic tools are crucial for determining the severity of the condition and the best course of action. Adopt lifestyle changes. Reducing plaque buildup and maintaining healthy arteries involves adopting heart-friendly habits. Eat a Mediterranean-style diet. Focus on foods rich in omega-3 fatty acids, leafy greens, whole grains, nuts, and healthy fats like olive oil. Avoid harmful foods. Minimize trans fats, processed foods, and excessive sugar or sodium. Stay active. Regular physical activity can improve blood flow and overall cardiovascular health. Quit smoking. Smoking accelerates plaque buildup and damages arteries. Consider medication or surgery. If significant carotid artery blockages are detected, your doctor might prescribe blood thinners to prevent clots or recommend procedures like carotid endarterectomy or stenting to restore proper blood flow and reduce the risk of stroke.
Key takeaway.
Temporary vision loss is not merely an eye problem, it's a critical warning sign of a potentially life-threatening condition. Treat it as a medical emergency and seek immediate attention. Early diagnosis and intervention can save your vision and potentially your life. Leg pain during activity, a sign of peripheral artery disease, PAD. Picture this. You're out for a walk, and suddenly, a sharp pain or cramp grips your calves, thighs, or hips. It's uncomfortable, but when you stop to rest, it eases up. You might dismiss it as fatigue or aging, but this pain could be your body's way of warning you about a more serious issue: peripheral artery disease, PAD. What is PAD, and why does it happen? Peripheral artery disease occurs when the arteries in your legs become narrowed or blocked due to plaque buildup, reducing blood flow to your muscles. This lack of oxygen-rich blood leads to discomfort, particularly during physical activity, when your muscles demand more oxygen. What does it feel like? The pain associated with PAD is often described as cramping, aching, or a sense of heaviness in the lower extremities. It commonly occurs in the calves but can also affect the thighs, hips, or even buttocks. The hallmark sign of PAD is that the pain worsens with activity, such as walking or climbing stairs, and improves after a few minutes of rest, a condition known as claudication. Why is this concerning? PAD doesn't just affect your legs. It's often a sign of widespread atherosclerosis, plaque buildup in the arteries, and indicates a higher risk of heart attack, stroke, and other cardiovascular issues. Ignoring the pain can allow the condition to progress, potentially leading to critical limb ischemia, where blood flow is severely restricted, putting your limbs at risk. What should you do if you experience leg pain during activity? Pay attention to patterns. If the pain consistently occurs during physical activity and subsides with rest, it's important to seek medical advice. See a doctor. Your doctor may perform tests like an ankle brachial index, ABI, ultrasound, or angiography to evaluate blood flow in your legs. Adopt lifestyle changes. Quit smoking immediately, as it's a major risk factor for PAD. Incorporate a heart-healthy diet rich in fruits, vegetables, lean protein, and whole grains. Start a supervised exercise program, focusing on walking to improve circulation. Medication or intervention. In some cases, blood-thinning medications, cholesterol-lowering drugs, or procedures like angioplasty or stenting may be necessary to restore proper blood flow. Practical tips for prevention. Stay active, even if it means starting small. Gradually increase your physical activity to improve blood circulation. Maintain a healthy weight to reduce strain on your arteries. Monitor and manage chronic conditions like diabetes, high blood pressure, and high cholesterol. Key takeaway. Leg pain during activity isn't just a sign of overexertion. It's a potential indicator of peripheral artery disease, which could point to broader cardiovascular problems. Acting early can prevent the condition from worsening and safeguard your overall health. Lower back pain, an overlooked clue to arterial blockage. Lower back pain is something many people experience and often attribute to aging, posture, or injury. But did you know that it could also signal a serious underlying issue: reduced blood flow to the spine caused by arterial blockage? While not commonly discussed, lower back pain may be a subtle red flag indicating broader arterial disease. The connection between lower back pain and clogged arteries. Your lower back, like any other part of your body, relies on a steady supply of oxygen-rich blood to function properly. When the arteries supplying blood to the spine become narrowed or blocked due to atherosclerosis, plaque buildup, the reduced blood flow can lead to tissue damage and pain. This type of lower back pain is often related to lumbar spinal stenosis, a condition where narrowed arteries affect the small blood vessels that nourish the spinal structures. The result? Discomfort that worsens with activity as the demand for oxygen in the spinal muscles increases. What makes this pain different? Activity dependent. Like pain associated with peripheral artery disease, PAD, lower back pain from arterial issues often intensifies during movement or exercise. Persistent discomfort. While it may ease with rest, the pain can become chronic if left unaddressed. No obvious injury. Unlike pain caused by lifting heavy objects or a specific injury, this type of back pain might seem to appear without an identifiable trigger. Broader implications. Lower back pain related to reduced blood flow isn't an isolated problem. It may indicate arterial disease in other parts of the body, including the coronary arteries, which can increase your risk of a heart attack or a stroke. What to do if you suspect your back pain is linked to arterial disease. Observe patterns. Take note if your back pain worsens with activity and improves with rest, especially if it's not linked to an obvious cause like injury or poor posture. Consult a healthcare professional. Speak to your doctor about your symptoms. They may recommend diagnostic tests such as an MRI or CT scan to examine blood flow to the spine. Lifestyle modifications. Engage in low-impact exercises like swimming or yoga to improve circulation without overexertion. Maintain a balanced diet to prevent further arterial plaque buildup. Manage chronic conditions like diabetes, hypertension, and high cholesterol. Treatment options. Depending on the severity, treatments may range from medications like blood thinners or cholesterol-lowering drugs to more invasive procedures, such as stenting or bypass surgery, to restore proper blood flow. Prevention is key. To avoid reaching this stage, take proactive steps to care for your cardiovascular health. Stay physically active to promote good circulation. Avoid smoking, as it significantly contributes to arterial damage. Keep an eye on your cholesterol levels and blood pressure. Get regular checkups to catch potential issues early. Key takeaway: lower back pain isn't always about strained muscles or aging joints. When tied to arterial blockages, it serves as a serious warning sign of compromised blood flow, not just to your spine but potentially to other critical areas of your body. Pay attention to your symptoms and don't hesitate to seek. Fatigue and dizziness, signals of poor blood flow. Do you often feel unusually tired or dizzy, even after a good night's sleep or a light day? Fatigue and dizziness may seem like common symptoms of stress or dehydration, but they could be warning signs of a much deeper issue: poor blood flow and oxygen levels in your body. These symptoms are especially common in women with coronary artery disease, CAD, and should never be ignored. Why does this happen? When arteries are clogged or narrowed, your heart has to work much harder to pump blood and deliver oxygen to your body. This inefficiency can leave you feeling drained and lightheaded. The lack of sufficient oxygen to your brain and muscles can make simple activities feel exhausting and affect your ability to stay balanced or focused. Key signs to watch for: unexplained fatigue, a persistent, overwhelming tiredness that doesn't improve with rest. Dizziness or lightheadedness, feeling like you might faint or lose balance, especially after standing up quickly or during mild exertion. Brain fog, difficulty concentrating, forgetfulness, or confusion that might accompany fatigue. Why women should pay extra attention. Studies have shown that women with CAD often experience fatigue and dizziness as early warning signs, rather than the more traditional symptoms like chest pain. This difference can lead to delayed diagnosis and treatment. What should you do if you notice these symptoms? If you experience persistent fatigue and dizziness, it's important to rule out serious conditions. Here's how to proceed. Seek medical advice. Your doctor may perform tests like an electrocardiogram, ECG, stress test, or angiography to assess your heart and blood flow. Blood tests can check for anemia or thyroid issues, which can also contribute to these symptoms. Monitor your symptoms. Keep track of when you feel fatigued or dizzy and whether specific activities make it worse. Note any accompanying symptoms, such as shortness of breath, chest discomfort, or irregular heartbeat. Adopt lifestyle changes. Stay hydrated. Dehydration can exacerbate dizziness and fatigue. Aim for 8 to 10 glasses of water daily. Improve your diet. Incorporate foods rich in iron, B vitamins, and antioxidants to support healthy circulation and energy levels. Exercise moderately. Low-impact activities like walking, yoga, or swimming can boost circulation and improve energy levels. Consider medical interventions. In cases of CAD, doctors may recommend medications like beta blockers or procedures to improve blood flow. If fatigue and dizziness are caused by other conditions, such as anemia or low blood pressure, targeted treatments will be suggested. Practical strategies for managing fatigue and dizziness at home. Rest strategically. Listen to your body and take short breaks during the day to avoid overexertion. Eat smaller, frequent meals. Large meals can redirect blood flow to your digestive system, worsening fatigue and dizziness. Move slowly. When transitioning from lying down to standing, take your time to prevent sudden drops in blood pressure. Why this matters. Fatigue and dizziness might seem like ordinary complaints, but they could be red flags for systemic issues like CAD or other circulation problems. Addressing these symptoms early not only improves your quality of life, but also reduces the risk of serious complications like a heart attack or stroke. Key takeaway: don't dismiss persistent fatigue and dizziness as minor inconveniences. These symptoms are your body's way of signaling that something isn't right. Seeking medical attention and making lifestyle changes can help you regain your energy and protect your heart health. Erectile dysfunction, a warning sign of reduced blood flow. Have you noticed changes in your sexual health, specifically in erectile function? If you're experiencing difficulty maintaining or achieving an erection, it's not just an isolated issue. It could be a warning sign of something more serious: reduced blood flow to the pelvic area. Why does this happen? Erectile dysfunction, ED, is often one of the first visible signs of vascular problems, such as atherosclerosis, where the arteries become clogged or narrowed. Just as clogged arteries can affect the heart and other vital organs, they can also restrict blood flow to the pelvic region. This reduced blood supply is crucial for achieving and maintaining an erection, which makes ED a potential early indicator of broader vascular health concerns. What causes erectile dysfunction related to poor circulation? When plaque builds up in the arteries, blood flow becomes restricted, reducing the ability of the vessels in the penis to expand and fill with blood. This can result in weaker or inconsistent erections. The presence of ED can often point to an issue with the coronary arteries, heart, carotid arteries, brain, or peripheral arteries, legs, and should never be overlooked. Key signs to watch for: inconsistent erections, difficulty achieving or maintaining an erection during sexual activity; decreased libido, a reduced interest in sex, which can be linked to poor circulation and low testosterone levels; reduced morning erections, a decrease in the number or quality of spontaneous erections in the morning. What should you do if you experience ED? It's important not to ignore ED, especially if it occurs alongside other symptoms like chest pain, leg cramps, or shortness of breath. Here's what you should do if you notice changes in erectile function. Consult a healthcare professional. See your doctor for an evaluation, as ED could be the result of other underlying conditions like diabetes, hypertension, or hormonal imbalances. A physical exam, blood tests, and possibly a Doppler ultrasound to check blood flow will help your doctor assess vascular health. Manage risk factors. Quit smoking. Smoking is one of the leading causes of poor circulation and vascular damage. Control cholesterol and blood pressure. Regular checkups to monitor and manage these can prevent further complications. Exercise regularly. Physical activity helps improve overall circulation, including to the pelvic region. Aim for at least 30 minutes of moderate exercise a day. Consider treatment options. Medications, PDE5 inhibitors like Viagra or Cialis, can help improve blood flow temporarily, but they don't address the root cause. Lifestyle changes, a heart-healthy diet, weight management, and stress reduction can have a significant impact on vascular health and ED. Surgical options. In severe cases, procedures such as penile implants or vascular surgery might be considered to restore blood flow to the penis. Mental health considerations. Erectile dysfunction can have psychological effects, leading to anxiety, depression, or relationship issues. Counseling or therapy may help address these aspects and improve sexual health. Practical strategies for managing ED at home. Maintain a healthy diet. Focus on foods that promote heart health, like leafy greens, whole grains, lean proteins, and healthy fats. Exercise regularly. Cardio exercises, such as walking, cycling, or swimming, enhance blood circulation and support overall vascular health. Stress reduction techniques. Practice mindfulness, yoga, or relaxation techniques to lower stress levels, which can also improve erectile function. Why this matters? Erectile dysfunction isn't just a sexual issue. It's often a sign that your cardiovascular health is compromised. Ignoring this symptom could lead to more severe health conditions, like heart attacks or strokes down the road. Recognizing ED early and addressing the underlying vascular issues can improve your overall health and quality of life. Key takeaway: if you're experiencing erectile dysfunction, don't just treat it as a nuisance. It could be your body's way of signaling that something is wrong with your blood vessels. Seeking early treatment, adopting a healthy lifestyle, and managing underlying risk factors can help restore both your sexual health and your overall cardiovascular health. Swelling in the lower extremities, a sign of poor circulation. Have you noticed unexplained swelling in your legs, ankles, or feet? While it might seem like a minor inconvenience, this symptom could be a red flag signaling poor circulation due to arterial blockages. What causes swelling in the lower extremities? When arteries become blocked or narrowed due to plaque buildup, blood flow is restricted. As a result, the affected areas, especially the legs, ankles, and feet, can experience fluid buildup. This swelling is often a sign that your body is struggling to circulate blood effectively, and it can worsen if the underlying issue isn't addressed. Why is this a problem? Poor circulation due to arterial blockages means that your tissues are not receiving adequate oxygen and nutrients. This can lead to further complications such as edema, fluid retentions, swelling caused by excess fluid in the tissues, particularly in the lower extremities. Chronic pain and discomfort. Swollen legs and feet can be uncomfortable and make it difficult to move freely. Skin changes. Over time, poor circulation can lead to skin discoloration, ulcers, or sores that may take longer to heal. What are the signs of swelling due to poor circulation? Look out for these warning signs. Unexplained swelling in the legs, ankles, or feet, particularly at the end of the day. Heaviness or tightness in the lower extremities, which may make it difficult to move. Shiny or stretched skin over swollen areas. Pain or tenderness in the swollen regions. Discoloration or coolness in the affected areas. What should you do if you experience swelling in your legs? If you're noticing persistent swelling, it's important to take action right away. Here's what you can do. Consult a healthcare provider. A doctor can assess the cause of your swelling through physical exams, blood tests, and imaging tests like an ultrasound to check for arterial blockages or other vascular issues. It's essential to rule out conditions like heart failure, kidney disease, or deep vein thrombosis, DVT, which can also cause swelling in the lower extremities. Follow a heart-healthy lifestyle. Exercise regularly. Physical activity improves circulation and can reduce fluid buildup. Focus on activities like walking, swimming, or cycling. Elevate your legs. If you experience swelling, elevate your legs above the level of your heart to help reduce fluid retention. Wear compression stockings. These can help improve blood flow and reduce swelling in the legs. Maintain a healthy diet. Limit salt intake, as too much sodium can cause the body to retain fluid. Eat foods rich in potassium, which helps balance fluid levels. Manage your underlying health conditions. Control your blood pressure and cholesterol. Keeping these in check can help prevent further blockages and improve circulation. Stay hydrated. Drink plenty of water throughout the day to help your body manage fluid balance. Quit smoking. Smoking damages blood vessels and reduces circulation. Consider medical treatments. If necessary, your doctor may recommend medications to help reduce swelling or blood thinners to prevent further clotting. In severe cases, surgical options such as angioplasty to widen narrowed arteries or bypass surgery may be necessary. Practical tips for managing swelling at home. Move regularly. Sitting or standing for long periods can worsen swelling. Try to move or change positions every 30 minutes. Use a cooling compress. Applying a cold compress to swollen areas can help reduce inflammation and discomfort. Keep your weight in check. Excess weight can place additional strain on your circulatory system, worsening swelling. Why this matters. Swelling in the lower extremities may seem like a minor inconvenience, but it can signal a more significant underlying health issue. Poor circulation due to blocked arteries can lead to more severe conditions like heart attacks, strokes, and even limb amputation if left untreated. Addressing the issue early on can improve your circulation and help you maintain a higher quality of life. Key takeaway. If you're experiencing swelling in your legs, ankles, or feet, don't ignore it. It could be a sign of poor circulation or arterial blockages that require attention. Consulting with a healthcare provider, making lifestyle changes, and managing your risk factors can help improve your vascular health and prevent further complications. Cold feet or hands. Have you ever noticed your feet or hands feeling persistently cold, numb, or tingly, even in warm weather? While it's easy to blame this on cold temperatures or poor posture, it could be a critical warning sign of poor circulation caused by peripheral artery disease, PAD. What's happening in your body? When your arteries are clogged with plaque, it restricts blood flow to your extremities, leaving them deprived of oxygen and nutrients. This not only causes coldness and numbness, but also slows down your body's ability to heal wounds or fight infections in those areas. How can you address it? Pay attention to persistent symptoms. Coldness, numbness, or tingling that doesn't go away is worth investigating. Look out for slow-healing wounds. Check your feet and hands regularly for cuts or sores that seem to linger. Adopt a heart-healthy lifestyle. Exercise, avoid smoking, and follow a diet rich in fruits, vegetables, and whole grains to improve circulation. Seek medical advice early. A vascular specialist can assess your circulation and recommend appropriate treatments, such as lifestyle changes, medications, or procedures to improve blood flow. Ignoring cold feet or hands isn't just uncomfortable, it can be dangerous. If you're experiencing these symptoms, it's your body's way of signaling that something deeper might be wrong. In the United States alone, it's estimated that around 900,000 people experience blood clots every year, with 100,000 lives lost annually due to complications from these clots. These figures highlight the seriousness of arterial blockages and other vascular issues that can arise from poor circulation. However, the good news is that early detection and timely intervention can significantly reduce the risks associated with blood clots and other circulatory problems. If you've experienced any of the warning signs discussed in this video, such as leg pain, cold extremities, dizziness, or swelling, it's crucial to take action. Recognizing the symptoms early can make all the difference in preventing severe complications like strokes, heart attacks, or even limb loss. While these conditions may seem overwhelming, know that there is hope. Many individuals have successfully managed or even reversed the impact of arterial blockages by adopting a heart-healthy lifestyle, seeking medical treatment, and making necessary lifestyle changes. Remember, it's not too late to take control of your health. By consulting a healthcare provider and following the steps outlined in this video, you can start improving your circulation today. The key to a healthier future lies in your hands. Pay attention to the signals your body is giving you, and don't hesitate to seek medical advice if you notice any concerning symptoms. You have the power to improve your vascular health and live a longer, more vibrant life. It all starts with awareness and action. Thank you for watching, and don't forget to like, share, and subscribe for more informative content. Stay healthy and stay vigilant.